Another mastermind hit.
Welcome back. What's up, everybody? This is a very special episode of 420 Live, Ohio. I feel the need to come on here to give you guys some updated information that I received from the Board of Pharmacy. So I'm going to wait a few minutes, ask everybody what they're medicating on, give everybody time to get connected to the stream. Make sure you guys are on here. So if you're on here, say something. Your comments will start showing up here in just 1 second when I turn them on. Let me just make sure they're all working. Let's see here. Facebook comments are now active. YouTube comments should be active. Guys should be on here anytime now. I'm also trying to bring in our folks from the Reddit. All right. Posting this. Hey, Paul. Yeah, that's because all my tracks are made by me. I'm Mastermind. For those who didn't know that, I make my own music. I've been making music since 1998 by myself. My brother helps me sometimes. He makes tracks, but all the tracks you've been hearing are produced and mixed down by me and me alone. Just for Facebook, YouTube, copyright reasons, I make my own music. I've been doing that for a long time. I see we got 3 people on here on Facebook, but that's not enough people. So I'm going to wait a few more minutes before I get started. So start sharing this video because this is about the town hall meeting that I requested with the Board of Pharmacy. I want to share with you guys exactly what they said. I'm not going to paraphrase. I'm going to put up on the screen exactly what they said. I'll put on the screen exactly what I said. And we're going to have a conversation about this and what we're going to do about it because it's really important. I'm just so tired of everybody on here trying to debate and make up things and get stuff started and nothing gets fixed and we just cry on social media and no one cares and nothing changes. I've had enough of that. I've had it. This email today just proves that if we don't unify the cannabis community in Ohio together, nothing is going to get fixed and the program is going to fail and go down in a ball of fire. Period. These prices that they're charging are outrageous in some places. The type of conflict resolution that's being proposed is ridiculous and doesn't make any logical sense to me. It's not how you address conflicts and problems in a business manner. I've been doing business and doing customer service and conflict resolution. Even though I don't work, I did it when I did work. And so I know that these things just don't make good sense when you're doing business, whether it's medical cannabis or just doing business. It's just not good business practice. So I see we have 5 people here on YouTube and we have a few people on Facebook. Hopefully we'll get some folks here on Reddit. Comments will now start showing up on the screen. Hey, I shared it in 2 groups. Thanks, Dana. Yeah, like I said, I want to make sure people understand this video because I see people think every time I do a video, it's going to be about a review or me just on here medicating. That's not the case. Today, we're going to really deal with what people are not wanting to deal with. And that's the fact that the Board of Pharmacy doesn't want to help us with our program. And I'm going to show you exactly what I mean by that, by showing you exactly the type of responses that I'm receiving when I email them in regards to concerns that you guys are telling me about. And I want you guys to help me write the next response. I don't want to write it myself. I want the community to help me write this response to these people so that I have your full support in what I'm saying. So that's why I'm going to post exactly what I said to them and what I asked for, and you guys are going to see what their response is, and you guys are going to help me craft the response right here live on my show. That way I know what I'm saying is something that people in the cannabis community support and stand behind 100%. I can't do this by myself, and I'm not going to do it by myself. I'm going to call on everybody that's watching this video and people watching on the replay to start helping me take action and demand answers for the way this program is not being run. It's not right. I've just had enough. I woke up today and I seen messages from people that I don't never get emails from. You know, and that just tells me the dire situation that we are in. And so if you didn't like me before, you got to me before, and you felt like we fell out or we got off on the wrong foot, or you want to make amends, you need to go ahead and just send me a text message. I posted my number on Reddit, and some of you people who I'm talking to out there, you already got my phone number. So if you want to go ahead and just make amends so we can come together, all of us, everybody, to try to get this straightened out. I'm to the point now that I feel that we need to engage the attention of the local media and maybe national media. This program is being ignored and it is being stonewalled constantly. I'm gonna get to it, but I gotta make sure enough people's on here watch it, because like I said, I don't think that it's gonna be beneficial for me just to talk to a few people. Last night we had one of our biggest Zoom meetings ever. I will be having another Zoom meeting on Saturday, and I will put the link out today, so you will have it early. I expect anybody that's listening to my video right now who really wants to do something and not just complain on Facebook and social media and Reddit and everywhere else about the quality of the products, the price of the products, home grow, delivery, all of that shit. I want to touch on all of it, okay? I just think that at this point we need a plan and we need to work together, and the message needs to be really clear. And so that's why we're doing this today. So I see we have 7 people on here on YouTube. That's a start. I'm gonna go ahead and jump into this. Hey, Demo84, good to see you. So for those who are not aware, I sent an email to the Board of Pharmacy back on February the 1st, asking them to come to a town hall meeting. I was gonna host it with Zoom. Seems like it was simple enough. And I want to show you what my message was, what I said, word for word. I'm going to read it to you. Hello, would you be willing to participate in a patient town hall meeting via Zoom to address concerns that patients have? It would be a RSVP event only. I would also like to invite LLC owners. I think it's important for patients to be able to share concerns with you and others directly in order for you to make improvements to the program. I will limit the people in the Zoom to 100 or less, and I can broadcast this live on my YouTube channel and Facebook so the general public can see it. I can also record it for you to have for your records. This is a safe way for you to hear directly from patients. I look forward to hearing from you soon. This was Monday, February 1st at 12:28 p.m. The next email that I sent was in regards to the LLC owners. Hello, I'm asking for permission to interview any LLC owners who would like to do interviews on my weekly show 420 Live Ohio via Zoom or other meeting software. I know some LLCs are afraid of getting in trouble for doing interviews with patients, but with COVID-19, this is a safe way for patients to meet LLC owners. No money would be involved, and I will be doing this as a public service. Please allow LLC owners to tell us about new products or special promotions they may offer patients. My shows are always on Friday at 4:20 p.m. sharp. I don't allow any drama or unprofessional behavior of any kind on my channel or my support groups. Patients should be able to meet people they are getting their product from in a safe and professional manner. I want to make sure everything I do is okay with you and that I am following the law. I really appreciate you responding to my emails. I have included a link of an interview I did with Dr. Bridget Williams about CBD so you can see how my live show works. I look forward to speaking with you in the future. Okay, so now you've seen what I've said. Now I'm going to show you what the response is that I received today, about 22 days later. This is after I sent an email to Grant Miller to see why nobody responded. So here is a message from Sharon Moore, who is, I'm going to show you her title. I'm going to move the comment out the way. Sharon Martine Moore, she's the Director of Medical Marijuana Operations. So you guys can write all that down, take your notes. Okay. Good morning. In your previous emails, number one, you permission to interview dispensary owners, including introduction of new products or special promotions, and hosting a patient town hall meeting with a board representative in attendance. Pursuant to or OAC 379:6-324 blah blah blah. A dispensary may not advertise unless the advertisement has been submitted to and approved by the Board of Pharmacy. The rule also prohibits dispensaries from advertising on radio, television, broadcasting, including internet programming. It's likely that the interviews you have proposed would constitute advertising under this rule and therefore be prohibited. However, the board notes that any dispensary may submit a request to participate, though the board's advertising portal and requests will be reviewed on its merits. At this point, the board declines to have a representative appear in a patient town hall meeting. However, as always, patients may email mmcp@pharmacy.ohio.gov for general questions, or mmcpregistry@pharmacy.ohio.gov for questions pertaining to patient's registration. Okay, so now that we've got all that stuff out the way and you saw what was said, what I said, now I just want to get to that. So first and foremost, although I did mention information about promotional products and whatnot, this is something that LLC owners are already doing on social media. So I don't understand the disconnect where a dispensary or LLC owner or cultivator is advertising on Instagram, Facebook, or wherever, but they can't come on here and talk to us directly. And they're barred from doing so based on this email. It doesn't make sense. How can you be able to do something? It's almost a hypocrisy. You're telling me they can do it on Facebook, they can do it on Instagram, which has already been censored to death. And then they just assume that everybody in the program, all 230,000 patients either use Facebook or Instagram. So that doesn't provide. And then also text messaging. I don't know about you, but sometimes getting a bunch of text messages at 7 o'clock at night or 10 o'clock in the morning might start to become a damn nuisance, right? Especially if you're not going to that place, but you still want to know what's going on, right? And so, what I want to show you guys too is that, some of these companies, they advertise on Instagram all the time. But not everybody's aware of that. Woodward, for example, they put out that they're dropping a new drop of stuff today. Other than you being on Reddit, Facebook, or Instagram, how are you supposed to know that if you're on YouTube? I'm telling you now. That's it, or you're on my website. Other than that, you have no way of knowing. So the fact that they're picking and choosing which platforms LLC owners are allowed to use, and then they don't want us to engage, that seems like a barrier that they're intentionally putting there to prevent us from gaining meaningful information. They expect people to go and drive out of their way to a vendor day to meet these folks and risk getting COVID-19 versus us just doing the interview here on the show and being able to talk to these people and ask them questions about their products and maybe question them about things that we had concerns about, or provide them with useful feedback that might be useful in improving their program. It sounds to me like we're getting stonewalled here. I don't know what y'all think, but it sounds like a stonewalling tactic to me. And, I feel like a response is warranted for this email. However, I think it's better that I take suggestions from the community and what to say and what to ask for. And if you would like to, I'm gonna put this back on the screen, and you can certainly capture the emails that she said to write to. And I'm totally okay with you going ahead and doing an interview. I mean, not an interview, but doing an email to them as they propose. But like I said, let's be clear. What does it say here? For questions pertaining to the patient's registry. What the town hall meeting was about wasn't about patient's registry only. It was about people standing in line at the dispensary. Dispensaries not answering the phone. Dispensaries not following COVID-19 guidelines and potentially exposing patients to COVID-19 without notifying them that they have employees who have tested positive for COVID-19. I'm talking about patients making racial slurs to dispensary employees and no reprimands being made. I'm talking about patients or employees throwing things at each other, unacceptable behavior. I'm talking about people smoking in the damn bathroom with their vape carts and opening their shit in the parking lot, completely unacceptable. Who is in control of this program? Who is taking names and looking and seeing who is going on? I'm formally asking out here in the open for a public investigation into the Ohio medical marijuana program. Who's running it? What compliances are being followed, if any? I'm now asking for support for a formal request for an audit and investigation of the entire program. I've had enough of these emails that basically just send people in circles. It doesn't accomplish anything. I'm not on TV yet, but I will be soon. So, you know, it just seems to me like a rule they made was designed to keep people from being able to gain information about these products in a meaningful manner. And they expect people to literally go hunting on social media to find out whether there's a promotion or not, or they expect people to sign up for updates. I also want to address the issue in regards to people not receiving the information about the hearing that they're having on March the 12th. The reason that you did not receive the email is because you didn't sign up for updates on their website. So basically, if you don't sign up for updates on the Board of Pharmacy's website, you will not receive important information regarding meetings and hearings like I do. So that is why you didn't get it. Always check if it's swag, it's going back, but everything else is great. Quality needs to be checked into. Sure, I understand that completely. However, at this point, I'm to the point of this. We need the town hall meeting. That seems to be the thing we need first. And if I have to host a town hall meeting without the Board of Pharmacy, what I intend to do is broadcast that town hall meeting live and also share it to local media and try to get their attention. And I'm going to contact some local media and tell them that the patients of the cannabis community are being ignored. That's what this is. I mean, she did answer my email, but Miss Sharon Moore, I'm just calling you out on this. It doesn't seem right that you're refusing to allow me, one of the only people who are doing videos with LLC owners, trying to get information out, to not be able to do this, and then saying, okay, well, they have to apply for it. And based on the merits, it should be public information. Whatever LLCs want to let us know about their products, it should be public information. That's like telling me that I can't learn about oxycodone from the manufacturer. The manufacturer of oxycodone is not allowed to get on and do an interview with the media and explain how oxycodones are made. Is that a rule? I doubt it. So all the censorship that they're putting out in regards to medical cannabis is not warranted. And like I said, other states like Michigan, for example, they've got billboards of advertisements about cannabis dispensaries, cannabis products, dabs, you name it. They got billboards of this shit. Here, we have to search for computer, digital, social media. I mean, a good example would be this document that I have here, that I should put up on the screen. And this is a pesticide list for all the pesticides that are in the program. Why isn't the Board of Pharmacy sending this out to us? Why do I have to get it from Bloom Medicinals? This should be public information that I should be able to access very easily from the Board of Pharmacy, or something they should just publicly send out every time a new cultivator is added. There should be a list that shows me what all these people are putting in their medicine. This should be available to everybody. Everybody should have a copy of this. And if you don't, let me know. I'll send it to you. This tells you who is using pesticides and who is not. How come we all don't have this shit? I don't understand it. It doesn't make no sense to me. And excuse my language, I'm pissed because I'm sick of this. I'm sick of people posting on social media and no one's listening. Guess what? I've been listening the whole time. And if you thought I wasn't reading your post and you was on there upset about your product smelling like mold and all that shit, guess what? I was listening and I was paying attention and I was taking notes. And so at the end of the day, there needs to be accountability, and we cannot get it without all of the people who are watching these videos that I do doing something with me. You cannot expect one guy, Anthony Riley, to send all these emails and then get these responses back. I need everybody that's listening to this video to send an email about what they want to know about, whether it's the pesticide list, whether it's you want a town hall meeting. If you want a town hall meeting, you send an email yourself to MMCP, whatever this is, Here it is again on the screen. You guys email them and tell them, because I'm tired of it. I've done it all I could. I've emailed these folks and been emailing. This is not even the first time I asked for the town hall meeting. This is actually the second time I asked for it. But now I've got an official response to show you guys. According to code ORC, whatever, we can't talk to LLC owners on my show, and they decline. I love the word decline, like it's a reason. That's a good reason. What is the reason why you declined the town hall meeting? And I didn't ask for a representative. I said everybody. I want the whole board there, not just a representative. I want them all there. The doctors, the sheriff, bring them all. I know Robert Kowalski, the patient advocate, supports a town hall meeting because I asked him. So why can't we have it? Well, you know why we can't have it? Because enough of you haven't sent an email yet and said we want a town hall meeting. So I'm telling you right now, I'm not going to do anything else further till I see more people stepping out and saying we want a town hall meeting, we demand answers, and we need these issues addressed. If you got shorted on days, if your days was taken away by mistake, if your ORS registry is still wrong and it still has the wrong information, or if you have another conflict where you went to the dispensary and they sold your product before you got it there, I want you to send an email. Quit telling me about it because I can't fix it. You see what they're telling me. They're telling me, send another email. So I'm just going to encourage y'all to do what the lady told me to tell y'all to do. Send another email. And if that's not working, send another one. Because at the end of the day, people like me and other people who are advocates who have been sending the emails the whole time, we're all getting the same type of responses back. According to lower code, blah, 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 we can't do nothing for you. By the way, send us another email if you have any more questions about the patient registry. I am so tired of hearing about the patient registry. It hasn't been fixed since the day the program started. It has been wrong the entire time. Has never been fixed. Email them and be professional. Don't send a bunch of nasty emails either. If I find out you did that, I'm gonna talk about you. Nah, I'm not. I'm just saying, don't send no nasty email. I'm not asking you to do that. I'm not asking people to send irate emails to the Board of Pharmacy. I'm not asking anybody to make threats. I'm not asking anybody to do anything unprofessional. What I'm asking you to do is be professional, which I know many of you are professionals, and I respect that. And folks who are on Reddit who keep wanting to criticize what I'm doing, why don't you get on here and help me? If you think you can do a better job or you have better ideas, I'm ready to listen. I'm ready to work with you. I'm calling you out. If you want to help me, let's do this. If you want to complain, go somewhere else. Because I want people to fix this program. I'm not going to keep listening and debating with people about what might be true and what not be true. I don't have time for that shit. It's true. I looked it up. You can Google it yourself. If you want the program to be fixed, you have to take action. You cannot just sit back and rely on Anthony Rowley to do it. You have to work with me or you're against me. And if you're against me, that's not going to help us. So I'm calling all of you out who keep posting in my Reddit, Facebook, and everywhere else trying to challenge what I'm saying. If you think you have a better way to make it work, I'm all ears. Why don't you post it on Reddit so I can see what your idea is? Because I'm all behind you, 100%. If you want to fix the program, I'm calling you out. I'm 100% behind all of you. But if you want to sit on here and complain and criticize what I say, guess what? I'm still behind you, but you better get your act together because everybody else is tired of this shit. Do you hear what I'm saying to you? Reddit people, Facebook people, YouTube people, Google, Twitter, Instagram. I'm talking to all of y'all, all 230,000 patients. If you are fed up with this shit, then you need to be sending an email today. And that's why I came on here. This ain't about a review. This ain't about me getting nothing. This is about us getting this program fixed. Board members, we don't need the board. We need our own organization. That's why I helped create the Patient Advisory Board. And we need everybody unified in one organization, not all these factions, not all these little Facebook groups. We need everybody to be a part of one central organization that is controlled and created by patients. That's what I'm saying. We need to unionize, organize, however you want to put it. We need one central organization that we all create together, that we all stand behind and say, this is the voice of all of the Ohio patients in the program. Now, however y'all want to put that together, again, I'm 100% behind you and I will follow whoever has a great idea. It doesn't have to be something I started. I'm happy to start it with everybody. But let it be known today, Anthony Rowley has had enough. And if you have had enough, I expect you to be sending the email, and I expect you to be at that hearing on March 12th. And if you didn't get the link, you better be emailing the Board of Pharmacy. I'm going to put on the screen again and asking them to send you a link. And you let them know you are going to be there and that you want a town hall meeting where you can actually speak and have your voice heard. And that you saw the email that you sent Anthony Riley that says that you declined. And you want to know why. Why are you declining the town hall meeting? Why won't you talk to us? And if you know people in the media, share this video with them and tell them we need answers and that you have had enough and you are tired of sitting back and not being able to figure out why your program is crashing, why your prices are so much higher than the people in Columbus, or why people in Cincinnati are paying 7.8% on their medicine when people in another place is only paying 6.5% on on their medication. We need to know why. Why can't we have a unified tax code for the program? Why can't we have universal pricing guidelines that stop medical cannabis price gouging? Why isn't it not available? And why in the hell are companies allowed to charge people the wrong tax rate on people's medicine and nobody cares? Nobody cares that they are overcharging y'all. Then in some jurisdictions you're paying more because they put in the wrong tax amount. Y'all don't care about that? I do, because they overcharged me several times. So, and I saw New Jersey legalized it. And, like I said, home grow and all that's wonderful. But right now, we need a town hall to address the issues that we got on hand right now. And, we can't even move forward on home grow or delivery if we can't even address the most common issue of going to the dispensary and placing an order without it turning into a stressful anxiety panic attack nightmare. I am sick of receiving pictures of patients standing in line in the cold, people lined up in their cars outside for hours and hours and hours. Average wait time 45 minutes to 3 hours. Unacceptable to me. And then the fact they try to do a survey with 1,500 people or 1,500 out of 200,000 and said, oh, we're doing all right. The average wait's only 15 minutes. Well, I guess so. If you survey a dispensary that's barely making any money and use them as an example, of course the wait's only 15 minutes if they're struggling because patients are literally not going there. They're so sick of this shit. They're going to Michigan where they don't have to go through all this stress and shit. Am I right or am I wrong? Tell me. Marion's 8.75% taxes? Say it ain't so. Say it ain't so. 8.75? Oh, let's not talk about that. Insurance, the insurance problem. So what many of you may not know is that some doctors are filing the recommendations under their insurance plans. So that means that the patient didn't pay for the recommendation. So there are patients in our program that I'm aware of who are able to get the recommendation for free because their doctor just wrote it as another doctor's visit and filed it with the insurance company. And they got their recommendation for $0. It does exist. Don't be fooled. And if you pay more than $100 for a renewal, you better contact me the next time. Don't you ever pay more than $100 for no renewal. You hear me? You better be trying to play less. I heard somebody last night tell me they paid $85 for a renewal. So if your medical marijuana doctor is still charging you $200 for renewal, you need to change. That's unacceptable. And I'm calling out medical marijuana doctors for doing that. There are too many organizations that are doing it for $100. So if you're still charging patients $200 for a renewal, you're overcharging them and you're not doing the patient a service. I'm calling you out. I don't care what you offer. And these people were doing it for $100, and you don't even have to leave your house. I had people telling me they went to the doctor and went through all that crap in the office and all that and paid more. 2 years later, they're still charging them $200 for a renewal. Stop it. Stop it. And if you don't, I'm going to start really telling y'all who's got the deal. And if you need a renewal right now, let me know and I will make some recommendations to you. I'm not endorsing anybody, but I'm just saying I'm not going to let my patients overpay either. How about that? So, like I said before, I feel very strongly about improving our program. I'm not here to create a drama. I'm not here to get people upset. I'm not here to get people to do things that are not professional or reasonable. And I'm not here to listen to people's drama about things that they know are just drama. And if you think somebody told me I'm from the 80s. I'm a hip hop dude from the 80s. And then somebody even had a nerve to call me a black jigaboo the other day. Well, guess what? Call me what you want. I'm still the guy trying to fix the damn program. How about that? What are you doing? Calling people jigaboos. Yeah, I'm calling you out. Because I ain't no goddamn jigaboo. My name is Mastermind. Mastermynd. That's how it's spelled. And that's how it's always going to be spelled. So you better put some respect on my name next time you call me a jigaboo, because I'm watching. Make sure you spell it right. Yeah. People, they get upset. I get upset. We all get upset. But that doesn't mean we can't love each other. And that doesn't mean we can't work together. So, like I said before, and I'm going to say it again very clearly to all these people here, is that if you were once one of these people who decided that you was going to talk shit about me and make a bunch of false statements about me and say all these horrible things about me on Facebook specifically, I'm letting you know today that I'm forgetting that shit. What's more important right now is us working together. So if you want to send me a message and apologize for the bullshit you said to me, which it was some bullshit, and you want to start over, this is your opportunity. I'm calling you out. I'm not going to say your name, but you know exactly who you are. The people who were sending me those nasty messages on my YouTube video and the people who were sending me those nasty messages in my groups. I'm telling you now, let's forgive and forget all that shit. Let's try to fix our program together. So if you're about fixing the program and you really do care and you are paying attention, because I know you watch my videos, then I'm telling you now, I'm ready to forget all the shit you said and pretend like that didn't even happen. Because it's more important to me for us to work together and to be a unified community. And I don't think it's no benefit to anybody for us to be against each other in any way, shape, or form. Okay? And I'll be very clear with you. This is the one and only time I'm gonna do this. So going forward, I'm telling everybody, I'm putting you on notice. You talk shit to me on the messages and say things to me that I know are disrespectful and try to make fun of my name and all that. I'm not no punk. And I'm not no child. But one thing I'm gonna tell you, I demand respect. And if you can't respect me and be respectful when you talk to me on the messages, don't think I'm just gonna let you run over me. I'm not gonna let nobody run over me. I can speak for myself and stand for myself. And I have a brain injury. And so I might not be perfect. I might have spelled something wrong. I might have made a typo. Hell, I might have missed a whole paragraph because I'm so into this. I'm spending all my time, 24 hours a day, seems like, waking up, looking at messages on my watch from patients. So yeah, I might make a mistake once or twice, but that doesn't mean my heart ain't in the right place. But I refuse to keep arguing with people and debating people about shit, the same old shit. And no, I'm not gonna sit on here and be no damn cheerleader from Michigan. This is the Buckeye State. And if you don't represent your own state, then you need to go move to goddamn Michigan. Because we are better than them. Period. Quit saying they're better than us. They're never going to be better than Ohio. I'm from here. I'm born and raised from here. I represent the Buckeye State. I went to college in Michigan at Oakland University. My family is from Michigan. I was up in Michigan studying the program in 2019. I've had a card since 2018. So don't tell me you know all about Michigan just because you went there a couple times over the border. I don't have no problem with you going to Michigan. That's your business. All I'm saying is that if you're going to Michigan, there's no need to brag about it and broadcast it to the whole social media network and let everybody know, look what I got in Michigan. Look what I bought in Michigan. Michigan weed is so much better. Michigan's concentrate is so much cheaper. Well, we're not disputing that. But I guarantee I'm going to represent Buckeyes. And I don't even like the Buckeye football team. How about that? But I love my state and I love my people. And if you love your state and you love your people and you want your program to succeed, think about that next time. Instead of going to Michigan, tell them like it is. Hey, if you don't fix this program, everybody's going to go to Michigan. We're not even going to bother with this damn program. Let them know the program is at stake. If we can't get results and we can't get reform and we can't get changes, why put our money in this program? I don't want it to fail. I love having my license. It's a blessing to have my license. It's a blessing for you to have your license. And if you are watching this and you don't have one yet, well, I think you should start reconsidering that. And if you need help getting one and you think it still costs too much money, I think you need to contact me directly. I'll make sure you get the best deal. And we have many other patients who stand ready to help you. You said, in fact, three managers think we're a bunch of junkies. And, and that's another thing that really gets under my skin is this negative stigma that has been associated with patients in general. I'm sick of that too. I'm sick of getting messages from people who are licensed medical professionals who are being terminated from their employment because they have a medical cannabis card. That's discrimination. Not racial. It's cannabis discrimination. Call it what the hell it is. If you lost your job because you have your card, that is discrimination. The problem is there is no laws in Ohio to protect us from any type of discrimination whatsoever. And you know what somebody told me the other night? Last night, they told me that a person went to a dispensary, they bought their medicine, and they got pulled over, leaving the dispensary, and all their shit was taken. All their medicine was taken. Even though they had all their paperwork, they had all the containers, their shit was taken. And the reason why they ran into a problem was because they opened their products and tried to change the packaging around in the car. So, public service announcement. Do not open your medicine until you get to a secure location, mainly home. Don't open it in the car. Don't open it in the parking lot. Don't open it in the bathroom. Don't open it for your friends. Take that shit home and open it at the crib. Because there's no reason you should be losing all your medicine to the police because you couldn't wait to get home. Don't medicate in the damn bathroom at the dispensary. Why? Because you risk us being punished for that shit. And I say us meaning all patients. Next thing you know, they say, oh, we don't have public bathrooms anymore. People was abusing that because they were smoking in the bathroom. So whoever's smoking in the bathroom at the dispensary, knock that shit off. Really, I'm for real. And it is, and a good percentage of the patients in this program are disabled. A good percentage. And I would love to know the numbers on that specifically. And I think another problem that really needs to be addressed at a town hall meeting is the indigent status. That doesn't seem to fit the definition of indigent. Indigent means poor and needy. It doesn't mean people on pensions, people on disability. Even though I receive indigent status because I'm on disability, I still don't think it's fair that other people that I know deserve it can't get it. People who are on Medicaid, people who get SNAP benefits, they don't get it. That's bullshit. I'm tired of sugarcoating stuff, people. I'm tired. I've had enough. And so, like I said, I really have a lot of respect for the people who are on here. I'm reading all of your comments, and I look forward to speaking to people further. And I hope today that this video helps mend some of those relationships with people who thought, well, Anthony Riley will never speak to me again. Well, guess what? This is the chance we can start over. So, like I said, if you know who I'm talking about and you know who you are and you want to apologize to me for the shit you said, I'm ready to accept your apology, and I'm ready to apologize back and move forward. Because if we cannot move forward, we're moving backwards. And I don't want to move backwards. So, let this today be one of them videos that inspires everyone in here to decide what they want to ask the Board of Pharmacy, whether it's you want a town hall meeting, you had a concern with a product, or you had some other issue. Stop complaining to Facebook. Stop sending me messages. Send the message to them. Because the only way we can show that we're really having problems is in the numbers. And if they all of a sudden receive lots and lots of emails about the same things and they continue to ignore it, it's just something we can document and say, hey, multiple patients send in messages, here they are, and they went unanswered. If it's just Anthony Riley and a few other Anthonys and a few other people sending in emails, then that's not going to make the difference. They get emails from us all the time, and we're nice folks and everything, but at the same time, we're not 230,000 patients. So, like I said, it's really important that you attend the meeting on March the 12th. And, you know, this hearing could decide whether the program expands or not. Either it will or it won't. We don't really know what they're going to do. The rumor is they're going to add more licenses. Well, that's a rumor. I want to hear them say it. And I also want to know what happened to the tier system being eliminated. What happened to the two-day unit being changed to a one-day unit? What happened? These things were already decided on, folks. And if you didn't see the hearing that they decided on, it's on my channel. Go back and watch the last two hearings and you will see these changes were already verified. They voted on it and they already approved it, and has yet to happen. So I'm gonna go back to this email with Miss Sharon. And I mean, no disrespect to Miss Sharon. I just want to say that because Miss Sharon probably will see or hear about this video. And what I'm getting at, Miss Sharon, is that your email here just basically makes it seem like patients really don't have any way to get these things other than what they're already doing. And your email basically makes it seem like patients don't really have a chance to get anything addressed, because, you know, we really just want to have an open forum with you. We don't want to have a hostile confrontation with the board. We don't want to have a shouting match with the board. We want to have an open and honest, respectful forum. And they have town hall meetings for all these other things. The police, the Black Lives Matter, I'm going to bring all that up. They have town hall meetings for everything else that they want to have a town hall meeting for. But we can't have a town hall meeting about our program. Why not? So here's what I'm going to do. I am going to allow you guys to send the emails in however you see fit. Please remain professional. I can't stress it enough. Do not send any irate emails on my behalf. Do not send nasty things to people. Don't say anything disrespectful, and only speak for what you know to be fact, not your opinion. I know there's a lot of opinions out here. Facts. Facts, not opinion. If you're not sure, ask me. I will find the facts for you if you need help. If you need help writing your letter, there are people on this group right now who are watching this who will help you. I may not be able to help you because I'm just overwhelmed with all the messages that I'm getting from people who want to do something, who are tired of watching this happen. And so, like I said, you have your mission. I expect you to do it with integrity, respect, honesty, and most importantly, I want you to make sure that you are sending a unified message to them that you want answers to these things, and that you have really valid concerns that don't have nothing to do with the damn registry. It's about your safety. It's about your health. It's about your medicine. This is your life at stake that they're playing with. You know, how many patients have we lost to COVID-19? Well, hell, they didn't bother to provide us with that information, but that seems like a piece of information I would be most interested to find out. How many patients did we lose to COVID-19? How many patients in the program got COVID-19? That seems like that would be valuable information to see if, well, the numbers of people in the cannabis community that got COVID-19 is high or low. Wouldn't that be useful information to figure out whether or not cannabis actually may have some type of positive effect in fighting against COVID-19? Well, the only way we're going to find that out is if we can get some research data on it. And the only way they can do that is for them to do research. And I think it's worth finding out how many people in the program actually did get it. Yeah, Mean Beans, I agree with you completely. We do need to go to the news media, and I'm ready to do that. So if somebody wants to share this video on the news media, I don't recommend we use this one because I used a lot of bad words because I'm frustrated. But at the end of the day, if you want to send a message to your local news media and say, hey, patients of the Ohio cannabis community are most interested in having a town hall meeting with the Board of Pharmacy and dispensary and LLC owners in an effort to address concerns that involve health and safety of the program, and make it simple. I mean, price gouging is another issue separate from this. However, it is important that we address the price gouging. And part of the reason that we're experiencing the price gouging is the things I already touched on. I'll touch on them again. Incorrect tax amounts being charged at some dispensaries. That is something that needs to be fixed. I can't say it's all dispensaries. I can't even say specifically names, because I'm trying to give them opportunity to make it right, and I don't see that happening for all of them. So if you're looking at your receipt, you need to do one thing. You need to look at the sales tax in that dispensary's location. You need to calculate the sales tax and make sure that the total that you're paying matches the sales tax rate. If it doesn't, you need to report it to the dispensary immediately, and then you need to send an email to the Board of Pharmacy to let them know that you discover a discrepancy with your receipts. Keep receipts, and if you can't keep them, whenever you get done at dispensary, take a picture of it and save it to your phone, upload it to your photo cloud. Take pictures of every receipt, every label, and every package. And the reason I'm telling you that is because you never know what could happen. It could be a recall. It could be an investigation. It could be anything that could help. And if you don't have the information because you didn't hold it, how can we show that there's a problem? So, like I said, please don't post things on the internet saying, oh, my weed was terrible. And then you don't say what cannabis it was, what cultivator it was, what was terrible about it, and provide pictures. If you said your stuff smells like mold, what does mold smell like? I mean, how do you know? Are you dealing with mold at your house on a regular basis? I mean, people say, I know what mold smells like. I do too. I also know that some of the weed that we got has some really exotically funky, runky, raunchy smells. And is it a moldy smell? I can't say that. But is it a smell that doesn't smell good? I can say that. Maybe it smells like shit. I don't know. But yeah, there might be something wrong with the odor. But if it passed testing and I got a test report on it, then I know it wasn't mold because it passed the test for mold. But, some cultivators don't give us test results and others do. So there are some cultivators out there who are providing test results, and you need to look at those cultivators and look at their lab reports and see what they're saying. And patients want undisturbed trichomes. Yeah, I hear you. I love my trichomes. I like to see frosty buds and nugs and colas. I agree with you on that, R.C. Robinson. And I think that it's important that, things are handled properly. And I think that, some cultivators definitely need some improvements on the curing that they're doing. I see a lot of rush curing going on. And I see a lot of people dissatisfied with the trimming of the buds. And so, I know some companies are trying to use machine trimming to save money and labor, while other companies are, doing the hand trimming and then charging us for that labor. So you kind of figure out, well, what do you want? Do you want to pay extra for something that's hand trimmed, or do you want to pay less for something that was machine trimmed? Why should I have to choose? Why can't I just have a happy medium? Why can't you just say, here's the hand trim line, it's this price, and here's the machine trim. If you want machine trim, you'll save money. If you want hand trim, this is going to be what it's going to be. And everybody should have those standards. We don't have universal standards in operating these dispensaries. One dispensary operates one way, another dispensary operates another. I'm going to give you a classic example. Verdant Creations, Newark. The only dispensary that I know has a drive-through where you can drive up and pick up, or drive up and order, and then drive off. You don't never have to get out your car. Only one that has that. Pure Ohio, the only one in the whole program I know who actually has it built in the iHeart Jane. When you arrive at the dispensary, you can click a button that says, I'm here. Why don't they all have that? Because we don't have universal operating standards. They're all using the same software to track sales, but we can't get them to operate the same way. Curbside should have been mandatory at all dispensaries, not optional. The law that they made, the rule they made it optional. That's why you don't see all of them offering it. And then the other barrier for that is that they don't all own the buildings that they're housed in, or they're in a shopping center which doesn't want the curbside traffic. Another mistake. The Board of Pharmacy should have never allowed dispensaries to operate inside of shopping centers. They should have all been required to create or move into a brick and mortar building that stood alone. Shouldn't be these shopping center dispensaries like Bloom Medicinals. Should have been its own building. And you see the reasons why now. Putting a dispensary in a tiny little place like Columbus and right by Cassidy, where people can barely get into it, and then when they get into it, the parking lot is smaller than the parking lot at a Rally's fast food restaurant. It's not reasonable. And then you have everybody going there because why? They're the only ones that offer curbside. Out of 4 dispensaries in the state, in the city, and it's supposed to be 5. We still don't know why Harvest hasn't opened. They gave these people 500. They gave the state $500,000, y'all, to clear up this debacle with the license. How do you give somebody $500,000 to get operational and to resolve an issue? And it's public information that it was resolved. And almost 2 years later, the dispensary is still not open, and we're getting no explanation as to why this is occurring. So we're literally short 3 dispensaries. There should be 54 dispensaries open right now. And last night I learned that there's even more dispensaries that I didn't even know about. Did you guys know that Fireland Scientifics has a dispensary in the old Burger King that never opened? Did y'all know that? Firelands has a dispensary? We didn't know? I didn't know that. Did y'all know that Woodward has a building here in Columbus, Ohio that never got to open because the damn board won't let them open it? Did y'all know that? Woodward is trying to be bigger and they can't even expand because the board won't let them. Yeah, it's a lot going on. It's a lot going on. So, you know, yeah, Firelands, their dispensary was located somewhere near the facility. I have not toured that facility yet, keyword yet. So I don't know exactly its location. I just know that it exists, and I know that it's an old Burger King. Those are the facts that I were given. And so, you know, what I encourage you guys to do this weekend, first of all, if you haven't already, I'm going to just say it. Do me a favor and hit that like, subscribe button if you haven't already. But most importantly, make sure that you try to schedule to come to the Zoom that I'm doing on Saturday. If you want to talk face to face, you know, we're doing this here, but I'm going to do these Zooms every weekend until we get somewhere. So every Saturday around 7:30, there will be a Zoom meeting that will be open to all of you. Whether you have your card or not, you just want to come in here and learn, ask questions, and discuss how we can work together. This will be open. You will need to RSVP or contact me directly for the link. If you just send me a message, hey, send me the link, I will send you the link. You will have it early. You don't have to show up at 7:30 either, but if you want to get there at the beginning of the meeting, then you need to come at 7:30. But the meeting will run until you guys tell me you're ready to go to sleep. So we're not going to set a time limit on it. Last night we were running until almost 11 o'clock. And if you feel like you want to have a Zoom meeting before that, I'm open. I'm open. We can do Zoom meetings tonight. We can do them tomorrow. But I'm doing one every Saturday that's open to everybody. Whether you like me or not, if you want to do something about the program, show up at the meeting. And I'll put it on the screen again, email the Board of Pharmacy about your problems and let them know you want a town hall meeting to address these problems. So again, I want to thank everyone on Reddit for your support. I really appreciate you guys standing behind me, rally behind me. I really appreciate hearing directly from people on Reddit. And that's a community that a lot of patients here may not be familiar with. But if you haven't already signed up for Reddit in the Ohio Marijuana group, I think you should. And the only reason I say that is because it just gives you another insight to what other patients are saying. As you can see, it's not just on Facebook patients are fed up. It's on other social media networks too. And there's over 5,000 patients on Reddit. So, you know, there's another community. If you're tired of listening to the stuff on Facebook or you want to hear different people's opinions and get a different take, then I suggest you check out Reddit and see if you can learn some additional information. I know that I am new to Reddit. I'm on Reddit, and I've learned a lot on Reddit so far. So, you know, it's another area that we can reach out to people. It's another social media network we can bring together. And my goal here, again, is to unify the community, not to divide us. And like I said, I think that, you know, it's important for me to just come out there and say, hey, if I offended you in the past, I'm formally apologizing to you now and saying, I need you. I need all of y'all, everybody. And if you don't want to work with me and you want to continue to do whatever you're doing, that's fine too. But just know that we're bringing everybody else together and we're going right at it as a team. Team Ohio Cannabis. That's us. That's all of us. Even the folks who are not in the program yet, they're a part of it too, because they want to be a part of a program that is winning, that is better than the one up north. Don't you want one better than them? Yes. So Reddit has taught me a lot of things about stuff I didn't even know about. And so, you know, and there's a little bit more freedom there. Also, I have the message boards on my website at ohiocannabislive.com. So if you don't feel comfortable with Reddit, you don't feel comfortable with Facebook, you don't feel comfortable on YouTube, I have a website that is nothing more than cannabis talk. Nothing else will be discussed there other than cannabis related things. And there is no censorship of cannabis on my website. You can create whatever forum you want and talk about things or concerns to you. However, I still think it's important to make sure that we zero back to the people who are able to do something about this. And people who are interested in emailing other people, senators or whatnot, I'm open to that. What I want you guys to do for me is to help me respond to this message. So what I look forward to hearing from you guys, don't try to do it in the comments. Send me an email at ohiocannabislive@gmail.com and give me some of your draft ideas on how to respond to this email to Miss Sharon, so that I respond in not only the most professional way, but I respond with the words and the support of the entire cannabis community. Our first message together. And I want to make sure I do it right. And I want to make sure you all approve of it. And that's what I'm doing different. That's how I'm starting my day today. Yeah, Cookies Columbus, yeah. Someday over the rainbow, it will happen. President Rory, had my car only a month and already frustrated with a lot of things. Can only imagine how it's been for people that have been here a while. Yeah, it has been definitely a roller coaster, and it has been, you know, it's frustrating. You know, for a lot of people, especially people who are just now getting in the program, like yourself, President Rory, who don't necessarily know where to get answers from, or where do you get reliable information. There is no educational resource for cannabis patients on the state's website. There is none. There is no way for you to get on there and like learn something. Like, I mean, you can. I mean, it's very hard to navigate this website. I'm gonna pull it up, show it to you guys before I go. Wait a minute, no, wrong thing. So, yeah. No, there's one other thing I want to talk to you guys about that I forgot, is that, and I posted this on my social media, I'm not going to post it on the screen right now, is that if you have an expired license and you were turned away from the dispensary because your license was expired, you need to send an email to the Board of Pharmacy, report that, because under House Bill 404, an extension provision was made specifically for expired driver's licenses, and those can still be accepted up to April. So I posted the official notice on my social media, so you can read that document from the Board of Pharmacy, or from wherever it was, the official rule, basically. I don't know if the pharmacy put it out, but it is in House Bill 404. And I encourage you, if you haven't, to read the entire House Bill 404, because it has a lot more to do with just cannabis. It covers so many things in our lives in Ohio that they have changed, modified, and made exceptions to, that, you know, may not normally be good business practice, but they're doing it because of COVID-19. So I think it's important that you go back and check and read through that. When I got in front, I found you, and that's been my main outlet of program. And I appreciate that, Vibe Spot. I really do appreciate that a lot. And, you know, it is other people that are making videos now. And I think you guys should also look into some of these other people who are putting out videos. So I'm going to name some of them off to you that I'm following. And matter of fact, I'm going to do you one better. I'm going to show you some of these other people who are making videos, and I want you guys to go out and look at some of their videos too, who I think are doing a good job, and you'll find the information they're providing is most useful in helping you make a decision on whether you should buy something or not. And just bear with me a second, let me pull it up, my channel. And you know, a lot of people do stuff, and you know, so the first person I'm going to show you is Captain Green Toker. Some of you guys have seen his videos, some of you have not, but I'm just looking for the right screen here, guys. Hold on a second. Where did it go? You know what happens when you have so many things to keep up with. Let's see. Where did he? Okay. Let me just do this. Let me just make a new one. Sometimes computers just don't want to cooperate, right? So this is Captain Green Toker. You can look him up just by his name, spelled just like it sounds. Captain Green Toker is a patient in the program who makes videos about various cannabis products. Also, there's another gentleman here, Rob's Ohio Marijuana Reviews, also is doing videos that are pretty straight to the point, honest reviews. So make sure you look up Robert. Also, another one here is Ohio Medicaid MJ. Very nice videos. He just got started, so definitely make sure you check out his channel. It's important that you support these other people who are trying to bring information to the program. It's not all me. There are other people here doing it too. Another guy here, Rodney Hash. Look him up. He's only got 117 subscribers, so let's help his numbers go up too and subscribe to him. Another gentleman who has, please put some prayers out there. He's had some family trouble, but some of you are familiar with 420 Ohio, who has been doing videos for quite some time and has great camera work, very beautiful images. If you like looking at pretty colas and listen to some really relaxing music, check out 420 Ohio, another great reviewer. Another patient who was also recently started making videos, Danny Johnson. So you can look him up under Danny Johnson. And he's also a very nice man and also doing reviews. He just started, so please help and give him support. Support these people who are trying to provide y'all with this information and make sure they understand. You know, if you want to connect with someone who is a medical marijuana doctor, I'm going to encourage you to check out Green Harvest Health, which is a lady I had on here. Her name is Dr. Bridget Williams. She is a licensed Ohio cannabis medical doctor. She's also a life coach, and she also has CBD products that are sourced from Ohio. So this is somebody you can reach out to who will respond to you. She also hosts open meetings and seminars, webinars about CBD on her channel. So, you know, look out for that information. I'll post it when I get it. And she does let people, her husband also is a medical cannabis doctor, and they're both wonderful people who are trying to help patients who need additional support and would like to talk to their doctor on a regular basis, not just at the renewal or the initial process. So if you're looking for a more detailed doctor, this is one of them I can say you might want to check out. And like I said, definitely, as you can see, she only has 8 subscribers. So I'd appreciate it if you would watch a couple of her videos and give her some support as well. Another lady I want to point you guys to who will be coming to my show in March. Her name is Dr. Latrice Montgomery. She is a professor at the University of Cincinnati. As you can see, she is a research psychologist. She has secured some funding to do research into our Ohio medical cannabis program. How about that? She will be looking for patients who would like to help her in her research to try to figure out what's working, what's not working, and try to create real live official research about cannabis. And that's something we need in our program. The argument for qualifying conditions all the time is that we don't have enough research on it, we don't have enough data on it, blah, blah, blah. So me and Dr. Montgomery are going to come on here and try to have a conversation about smoking and vaping. And so, definitely check out Dr. Latrice Montgomery. You can search her under her name and watch some of her videos. Not all of them are going to be about cannabis, but she does do some videos that are about marijuana or cannabis, however you want to say it. And like I said, she even did one here, BET Smoke Marijuana in Black America. So, if definitely give her a shout out and check it out. I mean, like I said, it's really important that we try to do this. Another one that I have on here is the Hall of Strains. I don't see their channel on here, but I think they're under this, let me see. I think it's under, you're seeing everybody I subscribe to. The Hall of Strains. And, another one you should check out. I really like the graphics of this one. I think it's pretty cool. And so if you haven't watched the Hall of Strains, make sure you check out this other patient. His name is Jamal. And he's doing a really good job of giving patients another look and a different angle. Instead of just doing a review, his question is always, should you buy an ounce or not? And I think that's a good question the patients should be asking themselves when you buy these various products. So make sure you check out the Hall of Strains and, let them know the support. He too only has 136 subscribers. So I know there's a lot more people who just didn't know that this guy's existed. So now you do. So make sure you check out some of the other patients who are doing videos. I do appreciate the support you provide to me, but it isn't all about me. It's about growing our community. And the more that we have people who are doing reviews, the more people can get information. So if you're interested in doing reviews and you simply just don't know where to start, you need support, you need help, I'll be happy to help you. If you would like to come on my show in Zoom or even Facebook rooms, I can bring you on the show and you can tell your story. You can tell me what you think. You can talk to me about home grow. You talk about whatever topic that's cannabis related that you would like, as long as it's going to be professional and not any drama. I will be happy to bring you onto my show here. So it's really important that we continue to unify and to come in here and be together. So I look forward to seeing you guys at the Zoom on Saturday. If you can't make it, no worries. We'll have another one next weekend. We will be doing some Facebook events as well that will just be Facebook only. For those who don't want to use Zoom, I understand it. That's why I'll be doing Facebook meetings as well at different times. If you decide that you just don't want to do any of this social media stuff at all, you are more than welcome to send me an email at ohiocannabislive@gmail.com. And some of you, many of you already have my personal phone number. I'm not going to put it on here, but you already got it. If you need it, you just need to email me and I'll give it to you. I don't have any problem in talking to people on the phone, on Messenger, on Zoom, or whatever it is that I can do to get everybody on the same page. Fix this program. And like he said, it's time for your boy to medicate, because I haven't all day. So I'm going to go ahead and do that with you guys. And I'd like to know what you guys are medicating right now, if you're still watching, or if you got bored and just got tired listening to me ranting. I'd love to know what you guys are medicating on. And, let's go ahead and do something together. Yeah. Let's see here. Yeah, so we got 16 people watching here. What's up, YouTube? This is a lot of people here. I feel glad we're all on here. Lemon Dosey Doe, yes, one of my favorites. I love Lemon Dosey Doe. Even at a lower THC, it still has never ceased to let me down. What else? Burkle Grow Ohio. Okay. What about Facebook? Y'all on their Facebook? What y'all medicating on Facebook? I see y'all on here. Man, I always do this. I have this other screen up here. Oh, wedding cake. Okay, I love wedding cake. Galina's Electric Peanut Butter Cookies. Yes, that was a good one as well. All right, so I got a couple things here. Maybe you guys help me pick what I should do. I've got some ice cream cake ice hash. I've got some sugar by Standard Wellness, some subcritical sugar. I've got some Delta Shift Lemon Aid Dosey Does by Buckeye Relief. I finished out the rosin from Han last night with the Zoom meeting. Y'all killed. We went through everything. I think I went through everything I had last night for that meeting. I might have to go buy some more concentrates. I also have some G-Perps. Gorilla Nut. Yeah, we talked about that last night, Swingo. A little blackjack from the president. Okay. Okay. I still haven't tried that blackjack, President Roy. I still need to really figure out. Pure Ohio Dark Moon. Okay. Okay. That sounds good. What else? What else? What else we got out there? What should I go with? Should I go with the G-Perps? The Delta Shift? The sugar? Or the last bit of my ice hash? I mean, it's really going. I have like enough for one dab of ice hash. Ice cream cake. I love ice cream cake. And, oh, I forgot. I also have some triple platinum candy by Fireland Scientific. So I got some rosin, I got some hash, I got some subcritical sugar, I got some live resin, and I got some wax. What do you guys think you would like to see? Choose. G-Perps. G-Perps. Let me stop, man. I ain't doing no endorsements for them, but I do love some G-Perps, though. But is it better than layer cake? Maybe I need to do a video on that. G-Perps versus layer cake. Dun, dun, dun. Y'all want to see a video on that? Oh, you do? The Vice Spot, you got the sugar. Tell me more. Tell me more, because I've been on the fence about that. Did you like it? Let me ask you this. Does it look like... Let me turn my background on so you can see this stuff better. Let me see. Hold on. Let me turn my background on. See, hold on. Okay. So, tell me... Live rosin for the win. Okay. Tell me if the Verano sugar looks like the standard sugar. That's not the best image, but there you go. What do you think? You think it looks better than that? I'd love to, matter of fact, Vice Spot, if you don't mind, I would love for you to send me a picture. Because I was wanting to get some sugar from Verano to try it out. No, sir? He said, no, sir. Uh-oh. Here's the G-Perps wax. As you can see, it's almost gone. This was a 0.9. Of course, I would never pay $90 a unit for it, so you know I got it on sale for like $70 a unit. Do you like it, Vibe Spot? You think it's any good? The G-Perps give me more live resin texture vibes. Okay, so is it... I'm sorry, live rosin. So do you like it though? I'm happy to sense... Okay, sweet, awesome, Vibe Spot. I would love to see them because I was wondering what it was like. So you think it's more like a rosin? You pay $89 for the... that's still a little bit pricey. I think that's still a bit kind of out overpriced there. So yeah, I think for that product it should be somewhere around $75 or $70, somewhere in there. Honestly, I think a lot of these concentrates should be about $70. You know, that's a good price point. 70, 75, 80 in an extreme case, but I think 70 is where it's at. I've seen some concentrates for 67, 65. That's before my discount, so that was pretty cheap for a 0.9. You know, because you get a half a gram for $35 somewhere else. Two of them $70. So I mean, I'm 0.1 off of a gram. I can live with that if it's good quality, right, Swango? All right, so Swango said rosin. Is that what everybody else thinks I should be doing? Is some rosin for the win? Some triple platinum? Because that stuff is strong, man. 50, yeah, well, you can get 50 if you catch a really good sale. You might get 56 with tax or 60. So, I mean, we're not that far apart, but we're not there yet. But we're getting closer. Yeah, I mean, I'm kind of like this. I have to have concentrates in order for me to save flowers. That's how it's always been, and that seems to have been the most effective way for me to do what I need to do. Because it really matters, the quality of the concentrate. Let's see, I'm getting some messages from Reddit, and this was just simply about the pesticides list. So somebody asked about Woodward, and let me see if I can address that here. Fire rock is Woodward, for those that didn't know that. So fire rock is listed under no pesticides used. So just to read it to you, I'm gonna read you the ones who don't use pesticides. Those companies are Argumed, Riviera Creek, Galena's, Pure Ohio, Vireo Health, Fire Rock, and Farkas Farms do not use any pesticides. So if you're watching on Reddit, I saw your message. I'm answering it now, but I'll go back and answer it on Reddit too, just so you can have it on there in the chat. But again, if you need this list and you didn't receive one, I think every patient in the program should have a copy of this list. So I did post it on my social media Facebook page. I will also post it on my YouTube page, because I can do that now. And so if you can get it from YouTube, you'll get it from my Facebook page. I will also put it on my website. I do think that the print is a little faded, but this is the most recent one that I was handed this year. So this is updated as of this year. I want to say thank you to Bloom Medicinals for bothering to do this. I know a couple other dispensaries are doing it. I think I have another one here. The Forest is also providing us the same thing. And just, this is the same information. It's just theirs is a little bit more smaller print, I would say. So Forest, enlarge the font on your list, make it bigger. But thank you for handing this out. Not all dispensaries are handing out pesticide lists. So the information is the same. Hey Brendan, you're new. Hey, you're new to Ohio. Comes from. I've only been in Pure Ohio because of no pesticides. Any tips? Well, if you're a person who is really just made up your mind, you don't want anything to do with pesticides, and you don't trust anything, even neem oil, which is one of the things a lot of cultivators are using, or coconut oil, or whatever, or some of these other things I've never heard of, I get the concern. So if you want to be a person who doesn't want to deal with companies that are using pesticides, I'll read that list again. Argumed, which is known as Meigs County. Riviera Creek, which is the one that sells lots of garlic cookies. Galena's, who is, selling things, and it's really high quality on some things. Other things maybe not. If you want the highest quality that they have, you're going to be buying their Artifact line, which is stuff that comes in jars similar to this. This is the second breakfast jar. It's empty now, thanks to the Zoom last night. And I think you already mentioned Pure Ohio. Everybody knows about Woodward, but a lot of people don't know they go by Fire Rock, not Woodward. That's the name of the company. The name of the company is Fire Rock. The name of the products is called Woodward. So, and then Farkas Farms, which the only thing they need to do is get rid of the bags, and maybe do a little bit longer curing on some of their flowers. But if those are all some of the ones who we know, according to this list, don't use any chemicals. Now, some of the other cultivators who do use chemicals, if you look into some of these things they use, like mineral oil, petroleum distillate, extract of neem. I'm just reading some things off of one randomly. Potassium salts, fatty acids. I'm not a scientist, and I'm not a home grower either, so I don't really know the significance of some of these things that they're using. Others who grow or have grown before will have better knowledge of this than I would. But I would encourage you to examine the list and go through each thing they use and determine based on your own whether or not you feel it's safe or not. And if you don't feel it's something you want in your body, or you don't want to take chances with it, then don't use it. But obviously a lot of these things that they're using are things that are obviously deemed safe by the Board of Pharmacy and the health department and wherever else, whoever reviews these chemicals or pesticides. So, me personally, I don't really like things that have things in them that I don't know what they mean. So, however, Some of these places, the list of items they use is quite short. You know, maybe like just one sentence. Whereas some of the other guys, it's like 3 things, paragraph maybe of stuff they're using. So, you know, I feel like Clutch, for example, they were using a lot more things before they switched over from Cadillac Peak. So maybe they made some adjustments on what they were using, but you know, some of these things I can't even pronounce them. Bavaria Bisiana strain GHA. I have no idea what the hell that is. Maybe you guys do, but hopefully we'll have some people who are smarter than me about growing to go through these lists and really break down what is good and what is bad, what's recommended, what's not. I feel that needs to be done from a patient angle and not from a board angle. I feel like we need to make our own list that kind of says, hey, these things are known for XYZ and these things are known for that, so that we can kind of have an understanding on what's really good and what's really not. 2 videos and 2 pictures. I think I just got your email. Let me see. Got it. Got you. Got the pictures. Ooh.
You had a new email.
Ooh, wow. That that looks like some molten lava right there. Now I really want some. Yeah. Thanks, ViSpot. That looks really good. Whoa. Yeah. Let me see if I can do the. Yeah, I mean, here's another picture that ViSpot sent us. It looks like it looks like the sun or something. That looks pretty interesting. I mean, yeah, I guarantee you're smelling terps, right, ViSpot? What's that? I just ordered from the dispensary. This is G Perps Sugar by Verano that he just sent us pictures of. The ViSpot just sent us pictures of. Thanks, Vi. And I'm gonna do some a little bit of triple platinum. You know, get my medication on. And so, like I said, we're gonna have a Zoom this weekend. Expect you guys to be there. Dab going in. Triple platinum. My temperature I'm running at is 516. I think at $70 a gram or $70 a unit, it's not that bad. Not that bad. Now, if you ran the temperature a little bit lower, I think you're going to get a lot more flavor. I did find out that the Delta Shift works a lot better in the packs than it does in my rig here. If you want to know what I'm using here, I'm using a it's called a Green Light Vapes G9 E-nail, mini E-nail. It goes from I think 70 degrees all the way up to 1200 degrees temperature wise. I'm using this with it comes with its own banger that goes down into what I have here, which is a reclaimer. Yes, I have a reclaimer. This is going to reclaim my medicine that I'm not using here. What that looks like is this. It's what I've reclaimed so far since I bought this. So it does reclaim. I'll do a more detailed video on this. And this whole contraption and this over here would also work with this bong here, which is made definitely a lot differently, but it does work with more than one. So if you already have a bong and you're thinking, I'm tired of a torch, you could get an E-nail, and you're just simply going to set the banger that comes with the E-nail into your already existing setup. No more torch. The only thing torch comes in handy for, maybe cleaning. And even the cleaning, I can show you in another video I'm gonna do, that I can just clean this by just turning this up to 1200 degrees and then to just burn everything off and make it clean again. So that's just something there. We'll do more videos on that, on bongs and things. That's coming soon. Now that I have my official setup. So you almost got the triple platinum today, and we went with Cincy Skunk instead. Okay, well, you know, yeah, I know the Terps vibe. I'm telling you, every time I hit the G Perps, yeah, I'm gonna hit something now, just on the count of you talking about it. I like the G Perps, and I found out you do need a little bit more heat for the wax, because if you do it at a low low temperature, this dab's for you guys. You won't get good vapor from it. So, you know. At 5:15, I'm getting terps. It tastes smooth. You notice I'm not coughing. The dab lasts a little bit longer. Now, only setback with using the wax, bite my throat a little bit, is that it will make your rig a little bit dirty. You get a little more residue when you use the wax than you use the rosin or resin. The sugar burns really clear, so like there's almost no mess with the sugars that I got. But see, the difference I think Vice Spot is that the Verano sugar isn't subcritical. The standard sugar is subcritical. So what you did is you showed me the difference. So now I'm definitely going to buy the Verano sugar so I can do a comparison between the two for everybody, so they can see, okay, the appearance, the consistency is completely different between the two. So they're two different type of concentrates to me. Same process, maybe not, but I have the lab report on the sugar that I have, and I'm going to try to get the lab report from Verano on the sugar that you got. So we can look at the terps, we can look at the whole makeup of it, how it tests out, see what the differences are. Well, I agree with you on stuff like that, Josh, because I love having my portability. Sometimes you just don't have the patience to do your rig. I mean, everybody has their own ritual with the rigs and the e-nail. Like I said, I've had other people's use other people's e-nails before or tried other rigs, but I've never owned my own. So I just wanted to be able to learn about it and be able to talk to patients about it. So I went ahead with the help of some friends and family to help me get an e-nail for my birthday. So thank you everybody to help me get my e-nail. They know who they are. They're watching. Thanks, Mom. And and Mr. Alexander. I just think that, you know, I want to know more. I want to learn as much as I can. So I'm never going to sit up here and tell you that Anthony Riley knows everything about cannabis. But I intend to learn everything I can. And whether it's from you or from the internet or from the processors or whoever is telling me these things. So sometimes I may say things and I may not tell you exactly where it came from. And I just want to let you guys know that because I've been to 9 different facilities in Ohio, and I've watched and learned and seen what they did, why they did what they did in some cases, and I've questioned things because I know you guys have questions. And, you know, sometimes I'm kind of like forbidden to say exactly where I saw what for obvious reasons, legality reasons. So I can't always tell you everything that I would like to tell you. But make no mistake that I'm really careful about the statements I make. This is why today, when I put this information out here on the internet today, I wasn't trying to do it to shame the Board of Pharmacy. But at the end of the day, I'm calling them out on the fact that they're not interested in hearing from us. That's the point of me doing this. It's a point that we have to say, look, we want to talk to you guys. Why can't we talk to you guys? Why does it have to be an email? Why can't we just speak to you why can't you face us? What is the issue with y'all facing us virtually? You don't want to see our smiling faces? Are you afraid we're going to do a big bong rip in your face while you're talking? We just might. Because we have a license to do that. And we're in our own private home. So if I want to come to the meeting and hit my packs while I'm talking to you, it's legal. I'm at my house medicating. I don't have to do anything differently. I want to be myself. That's why a lot of times you see me, I get on here and do a video, I literally just, it happens. I don't pre-plan a lot of these things. I just do them because I know I have to. I get messages, I keep getting texts. I was like, gotta go live. I gotta come on here. I gotta talk to people, and I gotta spend time. I can't just rush through everything and try to hurry up and just flood you with information and then try to do a review. I just spend time with you guys and have conversation with you, to listen to what you're telling me, read your messages, to understand your frustrations, and to share with you that I am just as frustrated as you are. Never think that I am not paying attention to what others are saying, even if I don't comment. Sometimes I just think it's not helpful for me to comment on the things. It's just helpful for me just to read and listen. But if I know it's totally wrong, I'm gonna comment on your comment. But don't get mad at me. Just ask me for more information and then I'll give it to you. I don't wanna fight you. I'm trying to help you. It doesn't do me no good to fight with people on here about this stuff. It's not helping. So, you know, like I said, I think I've covered a lot today. I think that I really have reached out as far as I possibly can, you know, and I'm asking local media, if you're watching my video for some reason, if they send it to you. Everyone in the cannabis community who has heard of me knows how to reach me. So I'm not hard to come by. So I really would appreciate some help from the local media in trying to convince the Board of Pharmacy that having a town hall meeting is the right way to go at this point, just to cover everything from COVID-19 situation concerns, safety concerns, the people that have concerns about whether or not home grow or delivery should be an option. These things need to be heard in open forum, not just squashed in emails or in hearing or meetings that we're not allowed to speak in. How can they have a program? It's like, to me, to be honest, Board of Pharmacy, it's like you're making the cannabis community out to be a bunch of children who can only communicate with you through a phone number or an email, and that we have no way to hold anyone accountable for mistakes that are being made. You know, I had a patient who went to the dispensary, okay? He went to the dispensary and he had already had an order. He got there and realized that maybe he didn't have enough money or maybe he needed to make a change. So he says, no, I'm not going to get X, Y, and Z because I can't get it right now. Maybe he didn't have enough money. So he had to modify his order. So they took the items off. He got his stuff. He got receipts for everything. He left. He also wanted to make sure his days was not affected. They told him it was all taken care of. He comes back later on to use those days that he saved from the last visit because he put the stuff back. And they took his days anyway. Now he had the receipts. This shows that this was corrected. He had one receipt where it had his order on the items that include items he did not get. And then he had the other receipt that shows the items he did actually get, which are missing the items that were taken off. And he emails the Board of Pharmacy because he's already tried to work it out with the manager. They just refuse to acknowledge the mistake, even though he has the damn receipts. Can you imagine? You have the information that proves a mistake has been made. All you want to do is get it fixed. They say, well, you need to email the Board of Pharmacy. I tell him, you need to email the Board of Pharmacy. See how I'm drawn into this same recommendation that isn't working? So he emails the Board of Pharmacy and he shares with me the message that he received back. And the message that he received back essentially said, you need to go back to the dispensary and let them fix it. We don't fix that here. This is the Board of Pharmacy telling this person that even though a mistake was made and he has evidence of it, that he still needs to ask the dispensary to fix it, and they're telling him to contact the board to fix it. Explain to me how that's productive. It's not productive. It doesn't solve problems. You know, it just doesn't. And, you know, the whole process of if a product is not right and a refund is warranted, the whole process of the patient having to reach out to the cultivator, and some cultivators are doing an awesome job. I mean it, awesome, job of taking care of patients for mistakes made, because mistakes do get made. And the fact that our cultivators take the time to acknowledge it, that's saying something. Because I'm gonna say it to you like this, and everyone watching this knows what I'm talking about. You tell me what dealer on the street is gonna let you buy some weed from him, call him up and complain about it and tell him it was trash, and give you your money back in a gift card and let you keep on smoking that weed you said was trash, let you keep eating them gummies you said was short, let you keep hitting that rosin you said was old, let you keep hitting that vape pen that still worked that you thought was short, and you still got your money back. Not everybody is getting that same experience, because not every cultivator and processor is doing that. Only the really good ones are, because they care about patience. That's why they sent you your money back. And they want to make sure that they get it right next time. That's why they sent you your money back. But the cultivators and the processors who don't even answer your email back and act like you never contacted them, I'm calling you out now. I hope you know your competitors don't do business like that. They actually respond. I think I'm more or less speaking to a lot of MSOs right now, but there are some private owners doing it too. If a patient contacts you about a product not being right, you should take care of it. Although you should also be pushing the Board of Pharmacy to create a universal process for this that the dispensaries are handling. When you buy something at Walmart and it ain't right, do you contact the manufacturer or do you take it back to Walmart? Am I right on that or what? I just don't understand it. Why in the world do I have to keep bypassing the store I bought it from, who may be right, the ones responsible for why the product is not right, because it was stored improperly, it wasn't handled properly when they received it? Why is that the cultivator and the processor's fault? Did somebody store the concentrates upside down? Or did they crush those bags in their vault? Why is that the cultivator's fault? But yet cultivators that care still took time to send you the money back anyway. You found a seed in your weed. The cultivator still either answered you and sent you your money back, or they just ignored you and pretend like it wasn't happening. You know, I was the first person in the program to file the seed complaint ever. Do you know that? I'm the first one that filed the first damn complaint in the program. The very first person. Guess what happened? Nothing. Zero. I didn't get no money back. I didn't even get an apology from anybody. And it was $60 a unit. So when I hear y'all crying about this, it smells like this, it's too dry, it's too moist, it don't look good enough, it ain't trimmed good enough. I have been there. And don't think when it ain't right that Anthony Riley don't send a message to let them know it ain't right. Whether it's Grow Ohio, Buckeye Relief, Clutch, Firelands, Galenas, whoever, Riviera Creek, you name it, Ascension, Hima, it doesn't matter what company it is. If it's not right, let them know it's not right. Don't let Facebook know. Let them know. Because they're not required to deal with you on Facebook. They're not required to deal with you at all. How about that? Did y'all know that? They don't have to send you nothing. There's no rule that says they have to give you your money back. There's no rule in the street where you get a refund. And I know for a fact up north they're not giving out refunds either from cultivators and processors. Now, a dispensary might give you some money back, but a guy from Ohio complaining about their product, you think they're going to rush to give us our money back? Well, I got this wedding cake and it's not like the one I get in Columbus. So, we're in a program that needs a lot of work. No, that great question, Jeepers. So, don't ask for freshest flour, because then there might be some flour that hasn't been cured long enough. A question you could ask is, you can ask the dispensary or your bud tender to what the harvest date is. You can look at the harvest date and look at the current date that you're standing there. And if that's less than a couple of months, you might want to leave it there. Let it sit there a little bit longer. If it's been sitting there since 3 months ago, expect it to be dry. It's been sitting in their vault under their conditions, not the cultivator's conditions. I think people forget this stuff may sit in a vault at a dispensary for months, weeks, days. I don't know. Depending on what product it is, it may never sell. Nobody never buys it. It's just sitting there. And eventually they got to get rid of it. Next thing you know, there's a sale on all such and such. We've heard that before, right? There's a super sale going on every Tuesday. That's awesome, Jeepers. Now, I appreciate you making that statement too. Not that we're trying to point any attention to one particular cultivator, but the point of the matter is that there are cultivators in our program who do care, and processors too. And I just want to make that clear, because I read a lot of complaints about cultivators and processors that aren't warranted, because they're blaming the cultivator or the processor for something that happened at the dispensary. You know, always remember, the cultivator and the processor delivers it to the dispensary, and after that, it is on the dispensary to maintain the integrity of that product and the storage that they have. And there are a lot of regulations around the type of storage that they can have, which may not be ideal, depending on the type of building it is, how old the building is, how good the HVAC system is, how good the humidity is being kept in the room, and how the employees themselves are actually respecting the packages. Now, a person who doesn't have a card, you know, and they got a bag full of garlic cookies might go. But somebody who is a patient who loves garlic cookies gonna be like, oh my God, I don't want to crush the bags. You know, I better spread them out like this. Do you understand? So a lot of people say bud tenders, they don't know what they're talking about. Why is that? Well, part of that nonsense is the rules and regulations that basically ban bud tenders from being damn bud tenders. Did y'all know that? They're not even allowed to say all the things that we already freaking know, because if they do, they're immediately in trouble and can lose their job for telling you something they know is right and you know it's right too. And then the system that they're using to calculate your days is ridiculous. It's complicated. They're like, I think 1, 2, 3, 4, 14, 5. You've used 17 days. Like, turn the damn screen around and show me that. Because when I get on my registry, it says I used 299 days. Why can't I see it for myself? Why do I have to sit here and let somebody? When I come in the dispensary, you should be scanning my ID with a touchless system. Boop, boop. On a screen should come up, this is how many days you got, this is when it start over. I don't need you to look at it, I need to look at it. You know, I should be able to log in like I do for my medication, for my prescriptions, and see when my next refill is. And if I prefer layer cake, then I should only be able to just get layer cake. So whenever layer cake's available, my dispensary should be calling me. Hey, layer cake is back in. Would you like to go ahead and place an order? If that's all I want, and that's what I'm medicating on all the time, and that's all I'm ever going to buy, then whenever it's available, I should know where it's at and how I should be able to get it. And I should be one of the people that be able to get it, because I'm the one spending all the money on it. I'm buying it. I'm financing it. If I got like 1 billion layer cake jars behind me over here. Lime sherbet, I haven't tried that yet. I'm on my list, Yeah, see, Josh, so you get it too. So you had no problems. And so I know that there are people who unfortunately didn't hear nothing back. And if you were a person who sent an email to a cultivator or processor about a issue of a product and you didn't get a response back, well, Mastermind would like to talk to you. So please do me a big favor and send me an email and let me know what happened when you contact them, and if possible, forward me any messages you sent, and I will be glad to help you try to get an answer. And if you don't get an answer, we'll keep pushing until somebody picks up the phone or picks up the email. But like I said, yeah, you said strawberries and pineapples, and I'm getting ready to grind up some of this pineapple upside down cake and see how it goes. See how it goes, man. But yes, guys, I think that, you know, you guys have your mission. I look forward to speaking with you guys later on today. I look forward to talking to people on Reddit who I hope are watching it, still watching it. And, you know, I look forward to seeing you guys on Saturday, too. Like I said, we broke the Zoom record last night. I really, really, really had a great time. You know, if I had the energy, man, I feel like we need a Zoom every day, because I feel like it really, really helped people connect with other patients. It helped people up here and in here. I really was moved by all the people. And, you know, even when I was getting kind of like, well, gee, golly, you know, say, what is it, past your bedtime? No, we can go all night if we really need to. But, and I'm willing to do all that. You know, whatever time works. If you want to set up private Zooms and just have a few people at a time, I will host them. I'm paying for the Zoom. It costs me $16 a month out of my Social Security check for me to do Zoom. So it ain't the free Zoom. I'm paying for it. I paid for this program. Well, Mom paid for it. So you know, this stuff that I'm doing, I'm taking and putting everything I got into it. And this is one of the most important things for me to do right now, is to get everybody together and get the program fixed. And to make sure that we are taking care of each other and respecting each other. And we got to do it that way. There's no other way to do this. And I watched how they did it in Michigan. And we got a long way to go and a lot to learn about how to work with each other. And we're not there yet. But hopefully today we've made progress. And so, you know, I'll be back for 420 Live on Friday at the normal scheduled time. Depending on what else happens, we could have more videos like this one pop up. Those who are interested in doing a Zoom tonight, if there's enough interest, we'll do another one tonight. But the one on Saturday will still be scheduled for 7:30. And that'll be open to people who would like to come and talk. We're not going to do anything that has any type of drama associated with it. So, you know, and try if you possibly can to just make sure that if you're going to be late, just send a message. If you want to go audio only because you got family business to handle and you just want to listen, that is totally appropriate here. And that's why I want to use Zoom, because if you have a bad internet connection, you can dial into the Zoom meeting with your phone number and you don't have to be on the internet. So that's something else that I'm paying for, is for us to be able to do that. If you want to come on the show, I've already told you, send an email and we'll schedule you to be on the show, and we'll be using what Zoom or whatever we got here. We have a couple different ways to do the show. I want people on here talking and saying what's on their minds about this, and I want to hear back from y'all. And we got to respond to Miss Sharon's email. So I'll be looking for y'all to send me suggestions on what to say and to keep me, you know, in line on what the cannabis community wants to do about this. So with that, I'm gonna see y'all guys later. I love y'all. Hit that like, subscribe button, and we'll be together soon. Maybe later tonight. Peace.